Live from Wave in Louisville, Kentucky. This is Listens Live.
Hello, everyone. Good afternoon to you, and thanks for joining us here on Wave Listens Live. I'm your host, Brian Schlonsky. It is Wednesday, so we're about halfway through this work week. Let's take you to the rundown now and show you what to expect. We have got Kentucky Kingdom joining us, talking all about their third annual Pumpkins at Kentucky Kingdom. We have those details for you coming up. We also have the Aero Fund here, previewing the 2024 Monster Mash Costume Bash. They even brought a special friend that needs your help. We'll tell you all about it coming up. But up first here today, we have Advanced ENT and Allergy back with us, discussing how they can help you get some relief from those pesky allergies. Of course, that time of year when that starts to pick up a bit, as we now are officially in the fall season. As we bring you here into the studio, we have got a doctor here with us to discuss all of this, Dr. Andrew Gould, who is from Advanced ENT and Allergy. Good to see you.
Hey, thank you for having me. I love an opportunity to come and connect with patients and talk about our practice, so thank you.
I imagine you have a lot of patients in the Ohio Valley because myself included, one of the allergy sufferers out there. We have a couple different topics to go over here with you today. Let's start, though, with sleep apnea. For people that maybe have never been diagnosed, if we can explain what it is and talk about why early diagnosis is so key.
Yeah, for sure. Like, sleep apnea is a super common problem now. It's pretty prevalent. Millions of people have it. I guess probably the most common symptom would be snoring, and loud snoring with blockages, and sometimes a bed partner or loved ones will say, hey, listen, you know, you really need to get this looked at. You're stopping your breathing. So just severe interruption of breathing, where when people fall asleep, they tend to lose muscle tone, and then that results in their airway being obstructed. And the problem with that is our oxygen level drops, and our brain doesn't like that. So it wakes us up to get a breath. And so all night long we obstruct, and we are woken up out of our deep restful sleep, which is so important to health, and we get a breath, and we go back to sleep. And that happens all night long, hundreds and hundreds of times. And so that's where it does have that impact on our health.
Yeah, I can think about over months and years, probably some long-term effects there, especially with the lack of sleep. So your Center for Excellence for Inspire, it's gained some attention, especially with new competitors who are in the marketplace now. So let's talk about the center and what sets it apart from everybody else.
So this sleep apnea has been a passion of ours for years, and we have been involved in a lot of the clinical trials at least for 10 years, if not longer. And so we were able to be involved in a lot of this development of the science of nerve stimulation therapy. And so we were first in the region really to participate in these, and then subsequently we were the first in the region to offer Inspire and those types of therapies. And that's kind of uniquely set us up to have quite a bit of experience. We're really the only designated center of excellence in the region, and that is based on our experience, patient outcomes, which is critical, success rate, and minimal complications. So we're real proud of that.
You mentioned some clinical trials. There are two that are going on for sleep apnea right now underway at your center. So fill us in on those. What's going on?
Of course. So we're testing a new medication, and it's an interesting concept. It may be an opportunity to improve muscle tone while patients are asleep. And so this would be like one of the first, if not the first, medical treatments for sleep apnea. Of course, there's a lot of research that has to go on, but these are how things get developed, is some new concept, a scientific idea. It's taken to the FDA. They allow a clinical trial to occur, and then we learn and develop new techniques over time.
It's pretty neat to think that all of this is going on right here in our community, and we're making waves with all of this. I want to talk a bit about Inspire as a treatment. Let's talk about how it works, and then if folks out there are thinking, oh man, I know I need to get this looked at, now's probably a good time. What would make someone a candidate?
Great question. So first of all, it's a surgical procedure with inherent risks. So, it's really for people who have failed traditional therapy, namely CPAP. So it's for patients who are considered intolerant or unable to use CPAP. So that's the first thing. Patients need to at least have a trial of CPAP. That's the little mask that people wear. Secondly, you have to have a certain body mass index, or BMI, and that's based on height and weight. So currently, these technologies aren't necessarily approved for very obese patients. And also, it's for patients with more of moderate to severe sleep apnea, and not necessarily for mild situations. Those can be treated non-surgically.
Gotcha. Yeah. Okay, that's good to know and good to keep in mind. Let's talk going beyond sleep apnea. I know you guys are involved in other clinical trials as well at the center. Let's talk a bit about sinuses, because that's another big one, especially around this part.
Right, for sure. Well, we really focus on a problem called nasal polyps, and those needed to be diagnosed and treated in unique ways. And so we see patients all the time that have been treated for maybe allergies or recurrent colds or things like that for years, and we look in their nose and find that they're filled with nasal polyps, and they really need to be treated in a specific way. The good news is, though, if we identify them, patients can get dramatic improvement, improved breathing, improved sense of smell and taste, and fewer sinus infections. So it's really exciting when we can find those and identify those. So we have trials specific to unique ways of treating nasal polyps non-surgically.
Gotcha. Okay. Well, obviously, with all of this, we're showcasing that treatments are advancing and they're always changing, and as we move into the future. So whether we're talking about sinuses or sleep apnea, where do you see all this going? What's next?
So the Inspire therapy, they stimulate a nerve in a specific way, but there is a lot of research going on in new ways to stimulate the nerves in the tongue and the throat and the neck. And so I'm really excited about the next generation of these types of implants. More effective, less invasive, better results.
That's what else can you ask for? Well, we know that as far as Advanced ENT and Allergy, there are 6 convenient locations all around our area. Let's talk about if people want to get in touch with you and need to go about figuring out kind of what the next steps are, what that process looks like.
I'd love to reach out to patients. You can reach us at our website, advancedentandallergy.com, and we can do online booking, or you can call and make an appointment on the phone.
A lot of easy ways to do it. We've got the website here on the screen, and if you look at the bottom, there is the website and the phone number for you to jot that down if you need to discuss with a doctor anything we talked about here today involving sinuses or sleep apnea. Dr. Gould, thanks for being on the show and sharing some of your wisdom.
Thank you for having me. I really appreciate it. Thank you.
Well, we have got 2 more great segments to go here on Wave Listens Live, so don't go anywhere. Coming up next, Kentucky Kingdom is back with us. They will talk all about the 3rd annual Pumpkins at Kentucky Kingdom. We'll have those details for you, any changes that are happening this year, what you need to know after this short break.
The Wave Charlie